Guardian's looking over the next few days about the role of the private sector in the National Health Service. We've chosen to do this now because the very controversial Government Act, the Health and Social Care Act, went through last spring, and many critics predicted that it would lead to privatisation of the health service. We've looked at some of the key areas where we know that the private sector was most interested in getting in and a sort of bridgehead into the health service, and in particular GP services and out-of-hours GP, general practice services. The first day we look at the largest provider of outsourced GP services to the NHS, a company called Harmony, which was sold very recently to an even larger private company called Care UK, making £48 million for its investors. And we've examined how they made that money, what sort of structure the company had, but also what the service looked like on the ground. And there are some fairly serious allegations that the company was running it by cutting costs, that it wasn't providing enough staff, particularly that its London service is regularly short-staffed, and so short-staffed according to allegations that it has been unsafe. The company denies that it's unsafe, although it does admit that sometimes the clinics it's been contracted to run haven't been open, or that the rota hasn't been full. So we've looked at some of the warnings that GPs have made about that and what the impact on patients has been. One of the biggest problems with the NHS and the private sector coming in is that so much of the information is really hard to get hold of. We still wanted to try and get a picture of what was going on, so we've drawn up a database for The Guardian where we've scraped all the publicly available information about NHS tenders and put it into a form where readers can easily search it. You can work out how many contracts for competitive bid are going out in your particular area of the health service, wherever you live, or if you're involved in it as a campaigner or as a worker, you can track what types of services are actually being put out for bid. And all that will be launched on the website. What we'd really love is for readers to come in and join us in this mapping exactly what's going on.